we had to stand on the step and wish him a happy birthday, and that was as far as we could get.
Anne's brother Robert died after catching COVID in a care home. She came to the inquiry to find out why he and more than 45,000 other vulnerable care home residents were not protected. Under a second day of questioning, former Health Secretary Matt Hancock defended a decision to allow hospital patients to be discharged into care homes without being tested.
Without testing anybody, Mr. Hancock, you don't know whether they're positive or asymptomatic or negative.
Indeed, but we didn't have enough tests. I fear that if we had left those patients in hospital, those who were medically fit to discharge, there is a high likelihood that more would have caught COVID and the problem could have been bigger.
The inquiry was shown a message sent in April from Hancock's then advisor, Jamie Njogu Goodwin, concerned about the lack of testing people in care. But he also describes people dying in care homes as often near the end regardless. Hancock defended his team's record.
Nobody has yet brought to me a solution to this problem that I think, even with hindsight, would have resulted in more lives saved.
Hancock describes the culture in government during the pandemic as toxic, saying it stopped him from doing his work.
We know that number 10 was chaotic. That's coming through loud and clear in the evidence. I'm not interested in the personalities. We need to understand why our government failed our people.
Hancock will have more questions to answer when the inquiry focuses on care homes. But next week, the same questions will be put to the former Prime Minister, Boris Johnson. Ashish Joshi, Sky News, at the COVID inquiry.